Thank you very much, Regina, for the presentation. And so, as Regina mentioned, I'm the coordinator of the Cochrane Insurance Medicine field. And today I will be presenting a little bit of the work that we are doing in the area of precision medicine. The title of my presentation today is the use of knowledge translation for insurance medicine, specifically for physicians, stakeholders, and also for decision makers. So the contents for today's presentation, first I will be speaking a little bit of what's Cochrane and a little bit of what are systematic reviews. Also, I will talk a little bit of the work that we have been doing in Cochrane Insurance Medicine. The third point will be the definition of the concept of knowledge translation, especially in the context of Cochrane. And the fourth point will be the products that we have developed in the area of knowledge translation. And we would like also to mention some of the challenges that we are facing when we want to implement all this knowledge translation in the area of insurance medicine. And lastly, we will discuss some of the conclusions from the presentation. So what is Cochrane and what are systematic reviews? Basically, I would like to say that Cochrane is a charity based in the UK. And the main objective of the charity is to develop systematic reviews with the aim of providing evidence to help making health decisions. So Cochrane is structured in different groups. For instance, the Cochrane review groups, as we mentioned earlier, are the ones in charge of developing systematic reviews, but also the Cochrane fields. For instance, Cochrane Insurance Medicine, it's a field. And our main task is the development of knowledge translation activities. We have also geographic groups, for instance, Cochrane, Switzerland, and also methods groups that are the one responsible for developing the methods and the tools to develop systematic reviews. Currently, there are more than 7,500 systematic reviews available in the Cochrane library online. And I need to say that all these systematic reviews are free of access for the whole population in Switzerland. I think we already mentioned what a systematic review is, but just quickly to say, basically summarize all the evidence that is available in a specific question or topic. Here's an example of a question. And as you can see here in the graphic, you put together all the studies that are available and then try to tackle this question. And at the end of the day, basically, you get an overview of what type of evidence is available in the scientific literature. So as you can see, it's a higher level of scientific evidence compared to individual studies. So what is Cochrane Insurance Medicine and what we do here? Cochrane Insurance Medicine, as I mentioned before, is a field that was created in 2015. And our seal is basically to make insurance medicine more evidence-based. How do we do that? We do that through the design and implementations of projects to promote the production, the dissemination, but also the use of evidence that is relevant for insurance medicine professionals. Currently, our members are based in Switzerland, in the Netherlands, in Sweden, and in Canada, and they work or are related to the institutions here shown in the slide. So who is our seal group? Basically, as you can see here, we have 6 target groups, specifically, as you can see, physicians, health professionals, decision makers, among others. So what is knowledge translation? So knowledge translation is defined in Cochrane as the process to ensure that the health evidence from Cochrane systematic reviews is used by those who need it to make health decisions. So basically what knowledge translation does is try to bridge, reduce the gap between the production of evidence that is relevant and that finally it's used and applied into practice and for making health decisions in the sector. Cochrane developed also a framework with different elements. I want to mention just a few of them. For instance, prioritization and co-production, what it means is that researchers need to work together with evidence users in order to generate evidence that is relevant and meaningful for the final evidence user. Also, in terms of packaging and push, it has to do with dissemination. which kind of formats or summaries of evidence are used to facilitate the dissemination of evidence to our target audience. In terms of facilitating pool, it has to do with use of evidence, and clearly there are several factors. For instance, to make sure that the users have access to the publications, but also, for instance, that the user has the competences to apply the basic principles of evidence-based medicine for decision-making in their practices. In terms of improved climate and building demand, what it means is that we need to have a close contact with all the evidence users, but also that we need to do a lot of work advocating for the generation or the production and the dissemination of use of evidence, in our case, specifically in the area of insurance medicine. So, what kind of products we have been developing in the last 5 years in Cochrane Insurance Medicine? I just want to show here a table with some of the principal or the more relevant products that we have developed. As you can see, they are organized or classified according to the different elements of the knowledge translation framework from Cochrane. Unfortunately, due to the limitations of time, I will only be able to mention a few of them. Here is the results of a survey that we did in Europe, and where we try to identify the evidence needs and the knowledge translation needs that the community of insurance medicine had. Also, I would like to mention a little bit of an interventional strategy, which is called the search filter topic insurance medicine in the Cochrane Library. Similarly, a project that we have developed, which is called Evidence on the Web. And finally, I would like to show an example of how we summarize evidence and help practitioners to put this evidence into practice. So I would like to start with the survey that we conducted. Sorry, the survey that we conducted. There's one missing here. A survey that we conducted, I'm sorry, there is one slide missing here. The survey that we conducted across Europe, basically, our main participants were professionals in the insurance medicine area, and we tried to identify the evidence needs or information needs of this population. We found really interesting results about it. For instance, that the evidence needs across Europe were similar among the insurance medicine community. But here I would like to point out those two specific results. The first one is we asked the participants, do you know what Cochrane is? And more or less 60% of the participants said, yes, I know what Cochrane is, but still 40% of the Cochrane insurance professionals or experts didn't know exactly what Cochrane was, or they didn't have an idea what it was. Additionally, we asked them, the participants who searched the Cochrane library in the last 4 weeks, did you find the evidence that you were looking for? And surprisingly, only 25% of the participants found the evidence that we were looking for. The reasons behind the results is not clear, but it might have to do with problems with the search of evidence, problems with the access to the publication as such, but also because definitely there is no evidence published in the area of interest for the participants. In this line of argument, we developed the search filter Cochrane Insurance Medicine in the Cochrane Library. The idea of this strategy was to compile all the systematic reviews from Cochrane that included in the method sections outcomes that are relevant for insurance medicine. The second aim was clearly to facilitate the search and the access to this evidence. So if you go to the Cochrane Library and you go to browse by topic, and then you will find the topic insurance medicine. When you click there, you will find around more or less 650 systematic reviews that report on outcomes relevant for insurance evidence. For instance, sick leave, return to work, participation, and so on and so forth. Even though we identified a really interesting body of evidence, we need to say that most of the systematic reviews that we found in Cochrane are intervention systematic reviews. However, for the insurance medicine practitioners, they also rely on other specific or important systematic reviews, specifically systematic reviews that focus on prognosis, causality, and also on assessment. Therefore, we try to develop a strategy called Evidence on the Web. The idea of the strategy is to compile not only Cochrane evidence, but also non-Cochrane evidence. So if you go to our website, you will find it there. And we have a collection of Cochrane and non-Cochrane systematic reviews, as well as Cochrane corners, which I'm going to refer later on, and some other studies that are relevant for insurance medicine. So here is an example of a Cochrane corner. In principle, a Cochrane corner is a summary of a systematic review that is applied into practice. So on the left, you will see one of the latest publications of our Cochrane corners in the SUA Medical, where we present the results of a systematic review on the treatment of rotator cuff disease. And as you can see below, we do a case, and based on the case and the evidence, we develop the case and provide some practical ways of use and apply evidence into practice. Here on the right side, there's also a Cochrane corner that we regularly publish in the TVV journal in the Netherlands. This one is on interventions to prevent injuries in the construction industry. So what are the challenges? The first challenge definitely is the need to generate synergies for the production of relevant evidence in insurance medicine. One of the questions that we have been asking ourselves, how feasible and how possible it will be to consider developing a shared research agenda in the area of insurance medicine in Europe. Very interesting question that still needs to be answered. In the area of packaging and pool or dissemination, one of the biggest challenges that we are facing is the need to compile and to disseminate evidence to a very diverse audience with diverse evidence needs. And when I refer to diverse audience, I mean not only to decision makers and physicians, but also to insurance professionals working in social insurance, in private insurance, life insurance, health insurance, and so on, all with very specific health needs. And clearly, the relevance of compiling non-Cochrane evidence relevant for insurance medicine, as I mentioned previously. In the area of building demand, it's critical to increase our exchange with specific stakeholders that I mentioned here. So, what are the conclusions for my presentation today? The first one is that Cochrane Insurance Medicine has been strengthening its capacity to develop and implement knowledge translation products and activities in the last 5 years, that there are significant gaps in the availability and the use of evidence in insurance medicine, and that our main challenges are the need to identify the evidence priorities of our diverse audience, but also to increase the production of insurance medicine that is relevant for the final user. And finally, the need to strengthen capacity to compile and disseminate not only Cochrane, but also non-Cochrane systematic reviews and evidence. So thank you very much for your attention, and I will be now available in case there are questions for my presentation.